still running, that would be great. You should have beside you this medical terminology book, as I know your other books at home, and it has some pictures for you to look at to help you through this section. It's on page 20 and 22 and 21. On page 22 it also has some more definitions. In your textbook at home, it's going to be page 63 and 64. The first thing I want to say is anatomical position. We didn't talk about that when we talked about prone and lateral recumbent and that sort of thing. Anatomical position, when you are describing a patient, you're going to assume they are in the following position. That is palms forward, standing, facing you. This is considered anatomical position, so that's where all of our reference points are from. Our skeleton in the classroom stands just like that with palms forward and arms down beside him. This guy right here is in anatomical position in your book. Alright, so I have drawn you an anatomical position, beautiful lady here, and then her not so pretty sister over here who's a little bit jealous. So we're going to start with the midline. Just hitting stuff in the hand. Okay, alright, that's fine. So the midline is an imaginary line drawn down the middle of the body. She's not exactly symmetrical, but you get the point. So this midline has a couple of different names. So first I'm going to write midline. And then I'm also going to write Mid-Sagittal with 2 T's. So this plane right here, this dividing line, divides the right from the left. If you're watching from home, you may want to pause this video and make you a little diagram there. So that is the midline or mid-sagittal. We have another line that divides us top from bottom. This line is around the belly button area, not exactly, but just kind of right in the waist here. Some people's belly buttons are in different places, so it's approximately in the belly button area, and it divides top and bottom, and you may see it called the transverse plane or the axial plane, and it divides top from bottom. And then we have another plane that divides us from front to back, and it kind of goes right down the middle of your head and side of your head and the side of your shoulder. And this one's got, it divides the front from the back. And the simple word for it is the frontal plane, but of course we can't be simple, we also have to call it something weird. So it's also called the coronal plane. So a lot of this stuff has 2 words, I don't know why, but we have to know both of them. So those are our 3 major body divisions. We have the midline, and the midline is also called the mid-sagittal plane. We have the transverse that goes across the middle. And then we have the frontal or coronal plane that divides the front and back, dividing the body halfway this way. I'll give you a second to write that down. All right. So the front of the body and the back of the body have names. So anything on the front side of the coronal plane is called anterior. And the opposite of anterior is anything on the back side, which is called posterior. So those are opposites, back and front, posterior, anterior. And then we have one more set of opposites, which is ventral and dorsal. And those sort of mean front and back, and they sort of don't mean front and back. So ventral literally means belly side. And for a human, belly side is the front. For a chicken or a frog, belly side is going to be underneath. I'm just going to make a little fish over here for reference. I don't know how to make fish lips. We just won't give it lips. Okay. So for the fish, they have ventral on the bottom, but on the top, they have dorsal. That's called the dorsal fin that's on the top. But we also refer to that as the back of the fish, right? So the opposite of ventral is dorsal. So on a person, dorsal is the back. On a fish, dorsal is the fin, is the top. So belly side, back side. Front, back, anterior, posterior. Now back over here, lost my green marker, here it is. The transverse or axial plane that divides us top from bottom divides our sections into two words. Above the transverse plane, also known as the top, is superior. Anything that's above it or anything that's above anything else. And if it's below the transverse plane, or if it's below something else, it would be considered inferior. So why is that anatomical position thing important? So if my little bear here, can you see the bear on the screen? So if my little bear here is standing in anatomical position and his feet are inferior to his ears, that's kind of obvious, right? But what if my little bear is hanging upside down by his foot? And I'm trying to explain to somebody where his ears are. Would I say they're now inferior to the foot? Because they're below because he's hanging upside down? No. We would not explain it that way. We would assume that the bear was in anatomical position but hanging upside down, so his feet are inferior to his ears. His feet are still below his ears because we're going to describe everything as if he were in anatomical position. Does that make sense? Okay. If you're not sure about that, hit me up and ask me. Okay, superior and inferior. We did front and back, anterior, posterior. We did frontal plane, sagittal plane, transverse plane, medial, and lateral. So, medial means towards the middle or towards the midline. Lateral literally means side. So it means towards the side or away from the midline. So medial's towards the middle, lateral's away from the middle. Lateral literally means side. If you think about laying sideways, that left lateral recumbent position, the word lateral is on the side, so it's like you're laying on your side. So away from the midline is lateral, towards the midline is medial. So the next one, we're going to use a point of reference. Now you can use the midline as the point of reference, but if there is another point of reference specified, such as the shoulder, we're going to use this red piece of tape right here as our point of reference for these next two words. So for these next two words, we have, I'm going to stretch this arm out just a little bit so you can see a little bit better. So I'm going to put a triangle that's purple here. And I'm going to put a circle that's green here. So this shoulder is my point of reference. Now I want you to understand that when I'm describing this to you, or you see it written down in a courtroom, that the green circle is further away from the shoulder than the purple triangle. So I'm going to describe them using this word. Distal, such as distance. And proximal, such as close proximity. So when I'm standing up in court, or I'm describing this to a surgeon, and I say to him, the triangle is proximal to the shoulder, but the circle, the green circle, is distal from the shoulder, then I'm trying to tell you that this purple triangle is closer to the shoulder and that the green circle is further away. Proximal and distal. All right, we got two more words. In case there's not enough on the board for you yet. We have one that means towards the head, and we have one that means towards the tail. The word literally means tail. So things heading towards the feet in that direction are called caudal or caudal. I think it's actually pronounced caudal, but for some reason I want to call it caudal. And towards the top is cephalic. Now this is where I'm going to get into that root word for you right here. That root word cephalo means brain. So If you put an A or an in front of a word, it means it's not there. So there's a condition that some babies are born with called Ancephaly, and that means some babies don't have brains. Those babies do not live. They can live inside the mother's womb for the entire pregnancy with no brain because the mother's brain is running everything. And then as soon as they're born, with no brain function or some part of brain function, because sometimes they have like a little piece of brain, those babies will die within minutes, hours, or days of birth. And the moms usually know that before that happens. So that's where they're trying to pass that law about not intervening when a baby's born alive, because those babies aren't going to live anyway, and the mama usually just wants to spend time with the baby and hold it and love on it until it passes away. But that condition is called ancephaly. So cephaly or cephalo, the root word for that is means brain. So towards the brain, cephalic towards the head, caudal going that way, going downwards, just towards the feet. All right, so we have anterior and posterior, superior and inferior, frontal, coronal, sagittal, transverse or axial, medial, lateral, distal, proximal, midline, superior, cephalic, anterior, ventral, posterior. Oh. We have everything. Okay. So what we're going to do next, once y'all are done writing, is I'm going to erase the words and see if we can label them. And I'm going to check on my video here while you're looking at my beautifully drawn pictures. Yes, it is visible and still running. If I'm erasing something you need to see, tell me. Okay. Now, practice run. What is this line down the middle dividing the body? It's going down the middle of the nose. This way. Midline, what else do we call it? Mid-Sagittal. Means in the middle. Sagittal. And what does it divide? Okay. So right anatomical position is always your patient's right and the left. All right. What is this line here? Axial. And it's also called what?
Transverse.
Transverse. You'll hear it called transverse more than you'll hear it called axial. What arm is missing? All right. What's this line here? All right. What do we call it besides frontal? It is also the coronal plane. So it might be the frontal plane or the coronal plane. And what does that plane divide?
The front and back.
The front and the back. Good. All right. What's another term for front and back?
Front is ventral and back is dorsal.
Okay. So what else does ventral mean?
Wasn't it anterior? Anterior.
Well, that's anterior is another word for front. What's another word for ventral? What's another description? So on the fish, this part is ventral. What is that? It's the belly side. So that makes dorsal the top. So what's our other word for front and back? We have anterior and posterior. Okay. What's next? Towards the head. Starts with a C. Cephalic is towards the head. Towards the foot, literally meaning tail. Caudal.
Very good.
All right. What is it when we go towards the midline? Medial, good. And what is it when we go away from the midline? Lateral, towards the side. I literally saw that stuff like 5 seconds ago. There it is, it fell. All right, we have a wound on the shoulder. We have one part close and one part far away. Which one is this that's far away?
Distal.
Distal is at a distance away. Now what part is this one that's closer? Proximal, it's in close proximity. Alright, let's see if we hit everything. Are we missing anything?
Superior and interior.
Superior and inferior. Of course we are. I'll just leave that in the floor. Superior is anything above something else or above the transverse line. And inferior, below. We get it all? Okay. Let me get my mask. So what we're going to do next is you guys are going to each get a Sharpie and some masking tape. Thank you. And you're going to come back here to these mannequins where you will be more than 6 feet apart. Each one of you gets a mannequin. And you're going to use that tape to draw the same lines that I drew up there, but I'm going to erase that.
Oh God.
So you guys are going to label your mannequins, and we'll see who gets done first correctly.
Can I use a sharper, smaller Sharpie?
Sure, if you have one.
Can I use this gray one?
Yeah. So I'm going to give you a close-up look here. And then I'm going to erase these and let them work. If you try this at home, send me a picture.